Can sex be an effective painkiller? Then, what are some of the most dangerous bedroom positions? Then, is there really such a thing as natural Viagra? That's next on Sex Talk.
Welcome to Sex Talk, where we will answer the questions you've always wanted to ask about sex and relationships. I'm Dr. Leah Janine, Associate Professor in the Department of Health and Human Performance at Nova Southeastern University. And joining me today is Sex Talk correspondent Derek Latta.
Dr. Leah, great to see you as always.
Great seeing you as well.
You look good in blue. I see you got the memo.
Yeah, you look excellent in blue as well.
Thank you very much. I appreciate it. Anyway, we have a lot of questions today, so let's get to the first one. How can I avoid anal sex being messy? What are the risks?
Well, the anus and the rectum are parts of the digestive system, and they don't naturally lubricate the way the vagina does. This lack of lubrication combined with the bacteria means that anal sex can be potentially messy and poses certain risks. The delicate skin of the anus is susceptible to small tears known as anal fissures, which can cause severe pain and bleeding. These usually heal on their own within a few weeks, but taking a break from anal play can help speed up the process. The risk of sexually transmitted infections is higher with anal sex than other forms of sexual activity. This is due to the potential for small tears in the anal tissue, which can allow viruses and bacteria to enter the bloodstream. Bacteria from the anus can cause other infections, such as urinary tract infections, and although rare, there is a risk of colon perforation, which is a tear in the colon wall. This is a serious condition that requires immediate medical attention if you experience heavy bleeding or severe abdominal pain after anal sex.
So anal sex is riskier than other types of intercourse, for example. So how do you reduce the risks, and how do you reduce the mess?
Well, start with trimming your nails, especially if you're using your fingers. Use a condom or something similar to reduce the risk of STIs. Make sure to use a new condom if you switch from anal to vaginal or oral play. Lubrication is also important. Lube reduces friction, making penetration easier and less likely to cause skin tears. Silicone-based lubes are often preferred for their thicker consistency, but water-based lubes are also effective and safe to use with condoms. Certain positions like doggy style or reverse missionary can provide easier access and potentially reduce discomfort or injury during anal sex. Experiment with different positions to find out what works best for you.
So let's say to avoid the mess, how about an enema? Will that work?
Well, opinions on enemas are mixed. While some people use them to feel cleaner, they can cause irritations and make the rectal lining more susceptible to infection. Instead of a full enema, consider wiping the area with a moist cloth or using a small ear syringe with warm water for a gentle cleanse. And try not to eat right before anal sex because eating can stimulate the bowel.
Yeah, I can imagine. It depends what you eat too, I'm sure.
Oh, gosh, yeah. Maybe,
we won't go there.
Yeah, maybe a heavy bean meal might not be.
Yeah, no chili, no beans, people. Any tips for cleaning up after?
Well, just make sure that you're keeping everything clean throughout the process. After sex, clean any areas that came in contact with the anus. This includes the hands, genitals, and sex toys. Use soap and water to reduce the risk of infections and UTIs.
Well, I'm glad you cleared that up, no pun intended. Next question, Dr. Leah. My migraines are ruining my sex life. What can I do?
Well, have sex. Sex can help. There is some research involving a questionnaire that was sent out to 800 migraine patients and 200 cluster headache patients, asking about their experiences with sexual activity during a severe headache and its impact on headache intensity. While most patients did not engage in sexual activity during headache attacks, a large proportion experienced relief.
So this thing about, hey, honey, not tonight, I have a headache. Nah, it doesn't fly
Well,
anymore,
I mean,
people.
no means no. You got to respect it. But sex does provide, pain relief in many different ways. Like a lot of women don't realize it also provides menstrual pain relief. So it's just, there's a lot of endorphins that can provide pain relief for all over your body. And if you're stressed or have anxiety, or you can do it on your own. Still producing all those hormones, yeah.
There you go. You have any tips that maybe help somebody have sex who's having a migraine to have better sex?
Well, of course, communicate with your partner. Let them know how migraines are affecting you and your desire for intimacy. And try reducing triggers. If you notice that you're more likely to have migraines at night, aim for more intimacy earlier in the day. Remember, migraines affect everyone differently. For more information and a few tips, check out what this doctor has to say.
Migraine is abnormal function in the brain, and this abnormal function results in abnormal sensory processing.
And the most common sensation processed is pain. That's why prevention is ideal. One option is a family of drugs called calcitonin gene-related peptide, or CGRP, monoclonal antibodies.
We're using that technology to create antibodies designed to target one specific protein. It's basically like putting a treatment in a car and giving it a GPS to go directly to one part of, in this case, the nervous system, and reduce that activity of that protein.
Another option is stimulating the vagus nerve.
There is a non-invasive vagal nerve stimulation device that we use for the treatment of migraine to try to reduce the frequency as well as severity of attacks when they do occur.
If prior treatments didn't work, it may be time to try again.
We have so many more options that are available now that are better tolerated.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
Let's take another question from a viewer who wants to know. What is the most dangerous sex position? Yeah, I want to know that too. What?
Well, it really depends on what you're reading, but reverse cowgirl is getting a lot of attention for being the riskiest sex position. This is a position where the woman sits on top of the man facing away from him, and it can become dangerous if the couple's movements fall out of sync. A slight misalignment during the thrusting can cause the penis to slip out and get crushed against the woman's pubic bone. This might cause a popping sound, which would be the sound of a penile fracture. It can lead to immediate loss of erection, severe pain, and sometimes even a hematoma, which causes significant swelling and discoloration. In some cases, a penile fracture may also involve damage to the urethra, leading to complications like bleeding from the urethra and difficulty urinating.
Wow, a penile fracture. You don't put a cast on that thing, do you?
No. Penile fractures are...
That sounds serious. That's some serious stuff.
If not treated properly, a penile fracture can lead to long-term complications, such as Peyronie's disease, and then it can become even more difficult to maintain an erection, leading to sexual dysfunction.
And what are the other high risks positions, for example?
Well, there was a 2017 study that looked into different positions and found that doggy style accounted for about 41% of penile fractures. In this position, the man is behind the woman, and the risk arises from the angle and the force of penetration, which can lead to similar misalignment and injuries. But even the missionary position, where the man's on top, also has a risk, accounting for about 26% of cases.
You know, you're ruining all the fun, Dr. Lee. I'm sorry. So no reverse cowgirl, no doggy positions.
I wouldn't say no.
No missionary, which is like the safest thing and probably the most vanilla of all positions.
So this is what you have to worry about with stats, though, right? 26% happen from missionary. But I feel like most people involve missionary in sexual play. So, of course, you're just going to increase the odds if that position is happening more often.
Okay.
So I still would assume it's pretty safe and that you're fine. I mean, I think it just, again, depends on the force of the thrust, and you just got to make sure you're lined up.
Okay, so what can you do to reduce the risk?
Well, mostly you just want to be mindful and intentional with your movements. And reverse cowgirl, avoid bouncing up and down too vigorously. Instead, consider rocking back and forth, which can still provide deep penetration while reducing the risk of slipping. Use support. You can lean on your back and put your hands on your partner's thighs or the bed, and all that can help with balance and control, reducing the risk of sudden movements that could lead to injury. And take your time when assuming the position and avoid aggressive movements. Slow, controlled motions reduce the chance of misalignment.
Well, you've redeemed yourself. Thank you, Dr. Leah. Let's take the next question. Do delayed ejaculation supplements work? First, remind us what qualifies as delayed ejaculation.
Well, men typically ejaculate within minutes of sexual stimulation. However, a hallmark symptom of DE is taking 30 minutes or more to climax. This prolonged duration can lead to physical exhaustion and discomfort for both partners. Causes of DE can be physical, such as nerve damage or hypothyroidism, or psychological, such as guilt or anxiety.
And how is it normally treated?
Doctors may recommend therapy, lifestyle changes, or addressing underlying health issues. In some cases, medications like testosterone, as well as others, are prescribed off-label, meaning these drugs are not specifically approved for treating DE, but they can also help.
Okay, so those are the off-label. How about supplements? Anything?
Well, there aren't really any supplements that have been scientifically proven to be effective. While some products on the market claim to enhance sexual performance, these claims really aren't backed by research. A lifestyle tip that might help is trying Kegel exercises. Anything that you do to have a stronger pelvic floor muscles might help you have more control.
The Kegel exercises again.
Yet again.
Come through. Love it. Next question, Dr. Leah. How can I have an anal orgasm?
Well, an anal orgasm is a type of orgasm achieved through anal stimulation, including touching, licking, fingering, and penetration. For a man, an anal orgasm often results from stimulating the prostate. For a woman, anal penetration indirectly stimulates the nerve endings located deep inside the vagina. Stimulating this area can also lead to intense arousal and lubrication.
So what are some of your tips to make this happen?
Well, you'll want to be in the mood by being both relaxed and aroused. And for that, you can do whatever it takes, right? Maybe that takes certain music, watching something sexy, or fantasizing. A hot bath might help loosen the muscles and increase blood flow. And you'll want to use a lot of lube. If it's not something you've done before, you can always start with toys and get used to the sensation.
Are there any particular techniques to try to make this work?
Try different things and see what works for you and your partner. Play with different parts of the body as a tease and explore different motions, like the come hither motion, pressing your finger against certain spots, or moving your finger in a circular motion. If you have a penis or you're using a toy, play with the pressure and depth. You could also try different positions. There are a lot of different ways to mix up the sensations, but you're going to want to try to start slowly.
And the finger circle down. Okay.
Finger circle, come hither.
I'll keep that in mind. Great answer, Dr. Lee, as always. Very interesting, too, by the way. Next question. I'm on painkillers and my libido has dropped. Why is that? And is there anything I can do? What do you think is happening?
Well, the main reason opioids affect libido is their impact on testosterone levels. Testosterone drives desire in both men and women. It also helps maintain muscle mass and strength. Studies have shown that chronic use of opioids can suppress the endocrine system, resulting in reduced production of sex hormones, particularly testosterone.
Okay, so what can be done about low libido?
You'll want to talk to your doctor. A personalized treatment plan for chronic pain is important, and addressing the issue of low libido should be part of this plan. Your doctor might suggest testosterone replacement therapy, which can help restore your hormone levels and improve your libido. And if you're taking painkillers, chronic pain might limit certain sexual activities. Different positions or methods can also help you enjoy intimacy without aggravating your pain. Your doctor could also help you navigate some other good options.
You mentioned testosterone therapy. That's something that once you start it, you have to stay on it. Is that correct? That's why.
If you want to achieve the benefits.
Yeah, so it's not like I do it for a month and it's going to go. You have to keep on doing it.
It doesn't go away right away, so you could cycle it. I mean, so you could do testosterone therapy and then stop, and testosterone levels gradually decrease and then again, but it will go away relatively quickly.
Okay, but you just start it up again, you'll be good?
Yeah.
Your body doesn't build up a defense or immunity
No,
to it?
it's not. No, your body's not going to build up like an immunity to it. However, what does happen is your body, your receptors, once it's seeing all this extra testosterone, then it's not going to produce natural testosterone. So there are other things that people will prescribe, like HCG. So you will take injections as well as testosterone, especially in the instance of like people trying to get pregnant. So if somebody's on testosterone for a while, their body then isn't naturally producing testosterone the same way, unless you're supplementing HCG, which is just another injection. So there's a lot to consider before testosterone therapy.
Okay, so talk to your doctor before going on testosterone therapy. Dr. Ali, our next question. If I have vaginismus, how can I make sex more enjoyable?
Well, vaginismus is an involuntary reflex that causes the vaginal muscles to tighten at attempts at penetration. This tightening can make any form of vaginal penetration, whether it's sexual intercourse, tampon use, or a pelvic exam, difficult or painful. It's thought to be both caused by physical and psychological components like anxiety, trauma, or other issues. So working through some of those can help. But there are some other ways to make it more enjoyable. You'll want to start by being open with your partner and seeking any additional support, like therapy to work through any emotional challenges.
And what else?
Well, consider more foreplay to reduce anxiety and prepare the body for penetration. Engaging in more foreplay helps relax the vaginal muscles and increases arousal, making penetration more comfortable. You can also explore other forms of intimacy and stimulation, like trying to get pleasure from clitoral stimulation instead of through penetration.
Great, thank you, Dr. Leah. This is an interesting question. I'm sure a lot of people are going to definitely be very interested. What herb is closest to Viagra?
Well, Viagra, known generically as sildenafil, is a well-known prescription medication used to treat ED by increasing blood flow to the penis. Unlike Viagra, which is only available with a prescription, some supplements and herbs are marketed as natural alternatives for improving erectile function. It's important to know that over-the-counter ED supplements are not regulated by the FDA for safety or effectiveness, but there are some popular ones that are thought to help.
Okay, I like that. So what are some of these popular herbs and supplements?
Well, there is DHEA, which is a hormone produced by the adrenal glands that contributes to the production of sex hormones like testosterone and estrogen. As DHEA levels naturally decline with age, some people use supplements in the hopes of improving sexual function. L-arginine is an amino acid that the body converts into nitric oxide, which helps relax the blood vessels and improve blood flow. Some studies have shown that L-arginine can be effective in treating mild to moderate ED, especially when combined with other treatments. There's also ginseng, which may also help increase nitric oxide levels. However, research shows mixed results.
You know, you mentioned like L-arginine. Those have been studied, but how about other supplements? Like you talk about ginseng. I've also heard of maca, for example, or ashwagandha.
Ashwagandha. There's tons of research on all of those, and they are helpful, and typically they're helpful in combination with prescription medication. And you might not need it. It really just depends on the severity of ED. But I guess to more directly answer the user's question, there is no supplement for the prescriptions, right? If there were, then people would not be having to go to their doctor. They would just be buying it online and moving on. But so there is nothing that's going to really work as well as your Viagra, Cialis, Levitra. Those are just going to be more effective. People are just too scared to go to the doctor. Like, who cares? Their doctor can't tell anyone anyway. Like, just go in for a consult, have fun, if it's an issue, not to use it recreationally.
And this research, have you personally done any research?
I did research with maca, and it was a randomized placebo-controlled study. So basically, it double-blinded, so I didn't know what they got, so I couldn't encourage them in any way. And they obviously did not know either. And I did find pre-test, post-test that maca did help improve many types of like sexual arousal, sexual functioning for both men and women. However, women were really affected by the placebo effect. So when I compared the change score or the difference in the placebo and the treatment, it was still higher in the maca group, but it wasn't statistically significant for women. It was still for men. So not to say that it doesn't help women, it's just that a lot of these sexual supplements, like other supplements, are greatly affected by the placebo effect.
How about Tribulus? Because that's kind of a new one I've been hearing about, and I guess there's a lot of press on it, a lot of marketing out there. So
I've done reviews. I haven't actually done the clinical trials for anything with Tribulus. So it is gaining a lot of popularity, and it is something that can also help for the same types of reasons, increasing blood flow and testosterone and all of those types of things. So it has been found to be beneficial. Some people do report an increased heart rate, diarrhea, things like that. But again, even side effects can be placebo controlled. I saw that in my study, or placebo affected rather. I saw that in my study that people were like complaining of headaches and all these things, and then they had to be removed. And we later reported like you were not taking anything. So just keep that in mind.
Here's a supplement with placebo effect. Horny goatweed. Right there, you're taking it, man. Right away, you're saying, okay. Right? Just leave them alone.
That would be an interesting study. If I just gave people one supplement, and I'm like, this is aspirin, and gave somebody else and called it like horny aspirin, like what would happen? You know, I don't know. I don't know how ethical that would be, but.
Well, if you ever do that study, let us know. We'll
horny aspirin study.
There you go. Anyway, our next question, Dr. Leah. Why does my ADHD medication make me hypersexual?
Something like Vyvanse, which is used for ADHD, does have side effects, and one could be hypersexuality, which basically means an abnormal increase in sexual thoughts and urges. These thoughts can really interfere with your daily life and relationships, but not everyone on this will experience hypersexuality. Some might have other effects.
Yeah, the first thing that came to my head was, man, this is probably a good thing to have. Right?
Well, it depends. Depends on how sexual you were to begin with.
Yeah, that's correct. But you mentioned, I think, in one of your our other shows about there's a symptom, perhaps, or maybe like too much arousal all the time for prolonged periods of time. Is that same thing as hypersexuality, what you're talking about here?
Yeah, so it can be, hypersexuality can be. And again, that is an issue. It is rare. Most people don't have a problem with being stimulated all of the time. And again, things like this would be without a trigger. So if you're somebody that's, especially adolescent boys, you don't want them, it's nothing to be concerned about. But if there is absolutely no trigger whatsoever, not a thought, anything like that, and you're just stimulated all the time, it is something that you're going to want to get checked out.
What can be done about that?
Well, if hypersexuality disrupts your daily life or relationships, it's important to talk to your doctor. They can help by adjusting your dosage, switching medications, or incorporating counseling or therapy.
And any other tips for people who are going through this?
You can keep communication open and honest, as always, with your partner, so that they know what's going on and they can help support you. And be careful, right? If you're acting on these urges, make sure you are being safe and getting tested regularly. You can always look into therapy or support groups for any additional help.
Yeah, don't be afraid to reach out for help if you need to. A lot of people are kind of like...
People are always scared with sexual things like they're the only one. Like, there are many people that experience whatever it is, ED, delayed ejaculation, hypersexuality, whatever it is.
And why do you think this show is so popular? Because people are asking questions that they're afraid to ask other people or embarrassed to. Don't be embarrassed. Ask these questions. We're here to answer those questions, but if you need to see a therapist, see a therapist. Whatever's going to make you better.
Yeah, absolutely. There's no shame in any of it, right?
Absolutely
like if you hurt your arm, you'd go to the doctor for that without a problem. So it's the same type of thing with any type of sexual issues.
Our last question of the day, Dr. Leah, you ready? Here we go. Whenever I masturbate, I pee. Why does this happen and how can I prevent it?
This can happen for a variety of reasons. It can be because of bladder pressure. When you're aroused, the bladder can contract, and if the bladder is full, it can cause urine to release. It could also be the type of stimulation. For those with prostates, stimulation of this gland can sometimes cause sensations similar to the urge to urinate. This might lead to the release of some urine. And the muscles that control the bladder and those involved in sexual activity can sometimes contract in unison, leading to accidental urination.
Could a UTI be causing this?
No, so a UTI is going to increase the urge to pee. So it's not necessarily like you're peeing uncontrollably, but if you have got a UTI, you just want to pee all the time. Your body's trying to get rid of all that bacteria there.
Yeah, okay,
and if you've got a UTI, you don't want to be engaging in these sexual activities anyway. That sounds awful.
Well, yeah, but some people do. But anyway, and Dr. Leah, sometimes you'll see in these porns, women squirting and all these things. Is this possible? Is the urine is happening during an orgasm? Or is that squirting? Is that real? Or?
Well, yes and no. Okay, so in pornographic movies, a lot of times they'll actually stop and insert tons of water into the vagina that the woman will hold and then release.
Wow.
Or they can just tell the woman to pee on cue, so that it looks like you're squirting. But in actual squirting scenarios, it's not like a constant flow. It's gonna be like a little bit at a time. And then in those types of instances, for women, it does have a PSA or prostate-specific antigen, even though women don't have prostates, but that's what it's called. It's similar. And so having that hormone is gonna be indicative of actually with an orgasm, with an intense orgasm and squirting. That fluid does come out of the urethra, so oftentimes it is combined with a lot of things that are also in urine. But it's not necessarily the same. But so not to say that every porn isn't authentic, because I can't speak to that. But a lot of times in porn it is fabricated.
But I'm sure that not porn happens sometimes in real life with people.
Yeah.
So.
Well, I'm sure women can probably urinate on cue too. That doesn't really sound like a fun sexual experience, but if you're into that, whatever. But yes, there are many women that can have very intense orgasms, and that can either be from vaginal or anal, or just certain women have the ability to squirt.
And how about if a woman wants to avoid peeing while having an orgasm, what can they do? What can be done?
You want to, of course, empty your bladder beforehand. Pay attention to the specific types of stimulation or positions that might be causing the issue and modify what you're doing. If you're concerned about a potential mess, consider placing old towels or shirts on your bed. This will help absorb any accidental fluids, making it clean up easier. Or try doing it somewhere else, like the shower.
Generally speaking, masturbation is a good thing, correct? Is that?
Yeah, absolutely. Exactly. Like it releases endorphins, dopamine, and other hormones that can enhance mood and provide stress relief. People may find that they sleep better. And for women, it could even help with cramps. But if you're having troubles when you try it, don't be afraid to bring it up with your doctor so that they can help. It was another great show. I loved answering these viewers' questions. We're all out of time, but we'll see you next time on our Sex Talk program where we answer the questions you've always wanted to ask.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.